Well, I suppose it's just some clarity in relation to the levels of spending on agency staffing and how we can address it. I suppose what concerns me is the agency spending continues to rise year on year. Agency staff do provide a vital service, but a healthcare system it cannot be built on and have long-term stability with short-term staffing solutions, which is what agency staffing is. As you said, the spend has increased from 56 million in 2024 to 68 million last year, and we're on track this year to, with the levels that we're seeing, it could reach 80 million for 2026. So
So it's
this,
pointing
the
to an
question,
increased reliance on agency staffing.
certainly there seems to be, and I suppose it has to, agency staff do provide a valuable service, but what it's about is continuity of care for patients and also staff morale, in terms of the team they have working around them, in terms of consistency, and also ensuring that the system is stable and sustainable into the future. And the question is, well, why are many healthcare professionals choosing agency work over permanent employment? So, like, we have seen that there are roles coming on board. The embargoes have been lifted, and to ensure, and look, there is a huge staffing drive among the HSE to bring staff in, but I suppose it's to address, well, is it to do with paying conditions, or what are the reasons why people are choosing staffing by agency over working
Mm.
permanently?
And we've heard about those challenges in recent years. The HSE did give you a response when you asked about what efforts are being made to retain staff and to recruit directly. And among the actions they say they're taking are the expansion of direct recruitment campaigns, increased international recruitment, engagement with graduate and intern programs, promotion of flexible working and work-life balance, and a number of others. Did you come out of that meeting, Rita, thinking, okay, the HSE are taking this seriously, and they acknowledge the problem and they're working to address it?
Certainly, time will tell as to whether certainly the measures that are being introduced are very welcome, but they have to be monitored closely in order to ensure that they um, produce significant results. Like, our healthcare workers are the backbone of the service, and we have staff that are internationally recognised, and maybe that's our downfall in some ways, in that when they go abroad they're offered permanent long-term positions abroad. So we have to look at the pay and conditions for our members of staff here as to what's attracting them to, not just, people go away for the experience and they bring back valuable experience as well, but how to attract them back into something that recognises the skills they've gained abroad, and that they have similar working conditions and work-life balance in Ireland when they return. So we need to look closely at that as well, in terms of attracting them back, but also encouraging them to stay at the start in the first place.
And it stands to reason that it should make for a more robust, reliable health system if you have those roles fully staffed, if you have all those positions filled in the health service, and there isn't that need to seek outside help from agencies.
Certainly, I mean, it is critical. You'll always need agency staff, but it's the growth in that dependence is what's concerning, and how we put conditions in place that convert, and they've spoken about that, how we convert agency staff into permanent staff, where they have experience in the role. They've maybe done agency in a particular hospital or a particular role over and over, and then how you look at converting them into long-term permanent staff as well. So that is all part of the work that's ongoing, and that's certainly welcomed, but it's something that needs to show results if we're to have a healthcare that is reliable, and that the staff morale is met, and that patients have continuity of care.